Welcome to our web conference today. I'm Ashley Klein from Prevent Connect, and you're joining us for What About Power and Patriarchy? Examining social cohesion and social inclusion strategies to prevent sexual and domestic violence. Prevent Connect is a national project of the California Coalition Against Sexual Assault, sponsored by U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the U.S. government, CDC, or CalCASA. So I just want to say that I've been really excited about this conversation, especially as we look at the new guidance from CDC in their Stop SV technical package and the strategies around creating protective environments and providing empowerment opportunities for women and girls. So our objectives for today, we're going to be looking at recent research on social cohesion and social inclusion when it comes to sexual and domestic violence. We're going to be having some candid discussions about how to address power imbalances and the conditions that contribute to SDV as part of social cohesion and social inclusion. And then we'll be identifying considerations, tools, and resources that can be used to guide efforts. And so a quick note on pronouns. If you've joined us for prior web conferences, we typically have this conversation as we start. But a pronoun really replaces a person's name when talking in the third person, and we think it's really important to model pronouns, the use of pronouns. Sometimes you'll hear people talk about preferred pronouns, but we really believe that someone's pronoun, it's not up for debate. Right? So what someone's pronoun is, that's very personal to their identity. And so while pronouns imply something about gender, they don't necessarily declare someone's gender identity. Some examples you'll see on the screen: ze, zer, zim, he, him, his, she, her, hers, they, them, theirs, see, here, and here's. And so we're really interested from hearing from our audience about what pronouns you go by. And I go by she, her, and hers. And so we're seeing you answer this for us, so thank you for helping us model this conversation around pronouns. And the chat box is going very quickly, but you'll see that there's a wide variety of pronouns that folks use. So thank you all for that. I'm really excited now to go ahead and turn the podium over to our host today. So I am joined by Lisa Fugia Parks, a program manager at Prevention Institute. Lisa, thank you so much. How are you today?
I'm doing great, and every time I see you do the essay, I just want to give you a hand. You covered a lot of ground in the last few minutes, so thank you for all that you do. Thank you, Prevent Connect community. It's great to be with you today. I hope everyone is doing well and taking good care. There is a lot going on in the world, and so it's great to have that opportunity to connect with you and to be in conversation with you. Very grateful for that opportunity. And I am joined by my webinar co-designer, Casey.
Hi, everyone. Casey. Happy to be here.
And you'll be hearing more from Casey today, which makes me very, very happy. But Casey does a huge amount of work to put these web conferences together, so thank you, Casey, for all that you do. Ashley described our objectives today, which really we're going to be looking at social cohesion and social inclusion strategies. We're going to be looking at research. We're going to be looking at work that's happening on the ground, hearing from you, sharing resources, etc. So let's go ahead and get started. So our first part of the web conference is going to cover some of the research at the foundation of social cohesion and social inclusion strategies. We do want to contextualize this web conference a little bit to say that, we recognize that sexual and domestic violence is really shaped by multiple factors in the social ecology. And so ultimately, we do need to address multiple factors, but today's an opportunity to focus specifically on social cohesion and inclusion, and we're going to explore the strengths and limitations of these strategies and how to maximize their impact in conjunction with efforts to address other factors as well. So I'm going to turn it over to Casey.
Yeah, so before we sort of, dive deep into this issue, we want to get an idea from you all about where you all are at in your own work. So we're going to do a polling question, and I'm going to launch it right now. And so in the bottom left hand of your corner, you're going to see 4 options, A, B, C, or D, and the question is, what extent are you integrating social cohesion or social inclusion strategies into your SCV prevention work? And A is not at all, B is we're just starting to think about it, C is we're working to strengthen one or both of these factors through at least one prevention effort, and D is if you're working to strengthen one or both of these factors through more than one prevention effort. So you can just, in the bottom left hand of your corner, type your answers, and I'm going to share those on the screen. And hopefully everyone will be able to see those. It looks like we have, a lot of people who have at least started thinking about it, a few who haven't, but we have, 35 folks who are just starting to think about it. It looks like there's a good number of people who have, started to have conversations, and a lot of people who are doing this work already in more than one effort.
Cool. Good to know. There's a nice range there. Okay, well, we will count on hearing more from you as we go on. Hopefully you'll share your initial reactions or your thoughts from having put some of these strategies into practice. So for this first section that deals with research on social inclusion and social cohesion, we have our first wonderful guest who I'm excited to introduce. Emily Rothman is an associate professor in the Department of Community Health Sciences at the Boston University School of Public Health. She has secondary appointments at the BU School of Medicine in the Department of Pediatrics and the Department of Emergency Medicine. Emily has authored more than 54 peer-reviewed publications, several book chapters, and in 2012, she was awarded the Linda Saltzman Award from Futures Without Violence and the CDC Foundation. And Emily's current research interests include violence perpetration and adolescent health. So Emily, it's great to have you here today to help with this conversation.
Thank you so much. I'm happy to be here.
Great. So why don't we start by going over a couple of definitions. So these are some pretty simple definitions that we want to put forward. I know that there are many definitions that are out there. First of all, social cohesion, which is sometimes referred to as neighborhood cohesion, or it's focused on social cohesion at the neighborhood level. And a definition here that we want to offer is mutual trust and solidarity in a community or a neighborhood. And social inclusion, the World Bank defines as the process of improving the terms for individuals and groups to take part in society. Another definition is the provision of certain rights to all individuals and groups in society, such as employment, adequate housing, healthcare, education, training, etc. So it's pretty broad. So Emily, we're curious to hear from you about these definitions and kind of how they relate to each other. Could you talk a little bit about sort of, I think on the next slide we have your definition of social cohesion. So if you could talk a little bit about this definition and kind of how you see these terms being related to each other.
Yeah, sure. I'm happy to talk about it. And I think before I do, I would just say to keep things really basic or as clear as I can, what we're talking about today is the idea that where you live matters. And what is it about where you live that matters? Well, some of it is how people treat each other. And over time, as social scientists have tried to figure out, well, it's clear that neighborhoods seem to impact people's health in different ways, and we can tell that it's something about the way that people treat each other. They've wanted to break that down even further, and it turns out that you can think about how are people treating each other in this neighborhood or in this community. You can think about it in a few different ways. So one of those ways that you just focused on is social cohesion, and we might wind up talking about other sort of dimensions or things that you could measure. But when people get curious about, okay, well, what exactly do you mean by social cohesion, you can sort of put it together that it means like how tightly together do people hang, right? Because that's sort of what cohesion sounds like it means. And, sure, different people have laid out different definitions, but this one thinker, researcher in '98 laid it out as being thinking like, well, okay, we can think about 5 different things that make up the social cohesion of a neighborhood. So basically how much belonging somebody feels, if they feel that they have common values with the other people around them, if they feel like they have an opportunity to participate in the local economy, so financially they feel included, that they have the opportunity to be involved in public affairs, that if there are differences, that there's tolerance for those differences in the community, and that the institutions around them are representing all of the people and their interests. And so if you have all of these things going on, we would say, well, this is a community that has high social cohesion.
So a couple of things I want to touch on there. It's really interesting, Emily. You said something that, well, first of all, I'm really appreciating this slide with this definition that really, really describes social cohesion as multidimensional. And sometimes I think, because it's the word social and the word cohesion, I just sort of simplify it in my mind as sort of like how, like you said, what is the kind of tightness of the relationships socially, but this is really multidimensional. It includes, economic cohesion, economic participation. So that's really fantastic to think about. But one of the things that you said that struck me that I don't think I've heard anyone talk about before, so I'm trying to sort it out. You said that this is really about the neighborhood and where you live matters. And what strikes me is that I hardly know my neighbors, and most of my social connections and participation, even in the economy, et cetera, is not based in my neighborhood. So are you saying that, is neighborhood really the unit, or can these dimensions of social cohesion come from outside of your neighborhood as well?
That's a great question, and there are definitely people who would want to get into more of a juicy debate about whether, for example, online communities can count as your community, and they certainly can count as your social support network. There's no argument about that. But there really is specific research about geography, about the neighborhood that you live in and how you do or do not associate with the people who are literally right next door or down on the street, or that you pass as you walk to your mailbox, and the way that people feel about each other in that small, whether it's just a group of neighborhood blocks or block group unit or a census tract. There are a few different ways to look at it, but yeah, Lisa, we are saying that where you live and how connected or disconnected you feel from the people right around you can influence health and well-being.
Okay. Well, I have more questions and more things that I want to discuss with you, but I also imagine that participants listening also might have questions as well. So why don't we go to another text chat?
Yeah, so we want to just ask folks what questions you might have that are coming up either, that have come up in your work or are coming up now during this conversation. You can just type into the text chat what questions you have about the definitions of social cohesion and social inclusion that we've given and how they relate to SCB prevention. So right on your right-hand side of your screen, just type that in, and then as we move along, we're going to take a look at those and try and address them as we go.
Yep. So let's go, as folks are typing in those questions, and let's continue to move forward with the research, and please just type in questions as they come to you. And I'm sorry to hear that folks are having a hard time hearing me. I'm not totally sure what to do about it, but I trust that the tech team is on it and that you will try to help improve the sound situation. I'm speaking as directly as I can into the microphone here, so hopefully it's some other issue that can be addressed. Okay, so moving forward, we didn't do a comprehensive or exhaustive review of the literature, but tried to pull some recent articles and offer them here to you. So what we found is that in terms of social cohesion and its relationship to sexual and domestic violence, there's some literature that focuses on particularly neighborhood social cohesion, as Emily described, and also the relationship between social cohesion to collective efficacy. So social cohesion is often discussed within the context of collective efficacy, and collective efficacy is really the combination of two factors, social cohesion and informal social control. And collective efficacy has been shown to be protective against CV. Also, that there are some links in the research that link social cohesion as a factor related to reducing child neglect and other forms of violence. Go to the next slide. Social inclusion, what we found is that is often, there's some research connecting social inclusion and particularly sexual violence prevention. So for example, a document titled Overview of the Worldwide Best Practices for Rape Prevention, published by the European Parliament, not a U.S. document, listed economic and social inclusion as key practices for preventing rape. So the extent of women's economic independence is linked to the level of violence against women, including rape, and full social inclusion of women is seen to mitigate the likelihood and consequences of rape. So therefore, policies for economic growth and social inclusion are seen as being relevant to preventing rape. So those are some of the terms, and I want to come back to you, Emily, because we have thrown out a lot of terms already in the last few minutes. Informal social control, social cohesion, social inclusion, collective efficacy, etc. So, you're a researcher. Who defines these things? And is there one right definition? Are there, if you can just sort of help me as not being a researcher, how should I be thinking about these various definitions and how these terms seem to be very related to each other and perhaps, overlapping in some ways? How would you put them together?
It's who gets to define them is there isn't one person who we all agree is like the definer of these terms. So probably different people use slightly different definitions, and probably standing back from them, the main thing to know is that these are all just different words that are trying to explain different ways that a community or a neighborhood may or may not operate. And I don't know if this is okay, but I saw a couple of questions in the side that I thought were really interesting. So I wanted to answer them if it's okay to do that.
That would be great. Please.
Okay. So Lori Seaman asked a question about, well, what's the evidence that social cohesion alone is a true protective factor, which is an awesome question because I think that gets at something, Lisa, that you all wanted to say. I may be foreshadowing something you plan to say, but social cohesion alone may not at all be helpful in terms of domestic and sexual violence. So this actually is a great way to explain why the definitions of these different dimensions that we're talking about are actually important. Because just because people hang well together, they share the same values, or I don't know, it's almost like they have a hive mind or something like that, just because they're all thinking alike and hanging alike in certain ways doesn't necessarily mean that they're anti-violence. So what's interesting is we know that communities that are more socially cohesive have the potential to, if you can find a way to use that potential and move it into collective efficacy, which is yet another one of these definitions and words that we're talking about, which is the capacity of that community to work together to change a problem, that has been found to be specifically a helpful factor in terms of adult partner violence, victimization, and actually teen dating violence perpetration as well. There's not been very many studies on these neighborhood factors and partner violence, either with adults or adolescents, but there's been a few. And we know that it appears from the bulk of those studies that have been done that there are some dimensions of neighborhoods that appear to be relevant. But you're right on for asking, well, is social cohesion alone enough? And I would say the answer to that is no, because just because people are on the same page doesn't mean that they're on the nonviolence page. So that was the key. And then, oh, okay, go ahead.
Actually, I think that's a good point. It's a good time to bring in our, a point that we did want to make, that social cohesion and social networks or anything in the social cultural environment should really be considered in the context of community norms. and that there is some research that shows that, social cohesion in the context of harmful community norms can be very problematic. So, for example, there was a study that found that adolescent and young adult males in dense, mostly male peer networks that are tolerant of domestic violence have higher rates of domestic violence perpetration. So the men in the group type were characterized by small, dense, mostly male peer networks with higher levels of what they were calling delinquent behavior, reported higher rates of IPV perpetration. And so we have a slide here that shows a couple of incidents of sexual violence in the context of fraternities, and of course fraternities are not, we want to highlight that as one example of sometimes this combination of a tightly woven, mostly male network that perhaps can have norms supportive of sexual violence or domestic violence, and these aren't the only examples of that kind of a network. But here are a couple incidents that have occurred. So just wanted to make that point. And Emily, did you want to address the other question that caught your eye?
Oh, I just saw my friend Lori Hart asking if there are ways to measure social cohesion, and the answer is yes. There are measures, and if you want to email me, Lori, I can get you one if you need it.
Great. Ashley, are there other questions that are coming up in the text chat that you think we should answer at this time, or I'm seeing some that probably we can address as we move forward, but anything else coming up?
Yeah, I think people are just looking at how these issues impact specific populations. So one thing is particular interest is folks who are living in areas temporarily, and then also around issues of gentrification.
Okay, so kind of coming back to this geography question again a little bit. So is there anything that you want to comment about that, Emily?
Okay, say that one more time just so I'm clear on it. So, I heard gentrification, but just say the question again.
So looking like the example was international students, right? They're only living in an area temporarily. And so in situations like that, what would social inclusion or social cohesion, what would those strategies look like? And then the other thing that was talked about was issues around gentrification.
Okay, so thinking first about the international students, I think, we don't have hard and fast information about how long you need to be residing in a particular place for this idea that neighborhood where you live matters for health starts kicking in. So, maybe 2 weeks living in a very, very unpleasant and bad situation could have health effects. Or maybe it takes a really, really long time of living in a place where there's great collective efficacy and trust and social cohesion for that to really have an impact for a particular person. So I don't know that we have a exact cutoff in terms of the timing, but I would say that even if it's a short-term residential situation, it does appear to be true that the features or the characteristics, both physical, whether there's good upkeep and physically people feel like they're living in a good environment, and interpersonally, if there are higher levels of trust and being able to go to each other for help with problems, those things help, and they help in instrumental ways for you. So if you were having trouble with violence, having better connections with the people right close to you and feeling like you can go to them for help is going to have a positive impact, even if it's short term. So thinking about ways to encourage those kind of connections with one another, even if it's in a dorm or students who are here not permanently, may be worthwhile. And then the other question about gentrification, that's a little bit out of my depth, so that's not something that I study. But I guess what I would say is that it seems to me that gentrification tends to create divisions within communities, and it tends to create distrust between different groups or factions within those neighborhoods and communities. And so there could be some widening of health disparities or health problems in places where gentrification is taking place if it in fact is eroding the sense of collective efficacy or social cohesion for that neighborhood as a whole.
Yeah, I mean, I've just heard so many heartbreaking stories of families, who were, or relationships, friendships being kind of torn apart by people being forced to priced out of a neighborhood and having to move to somewhere far away or that kind of thing. So I would imagine it can be very disruptive to social networks and social support. So let's go to the next slide, and because I think, Emily, you've alluded to some of this, and just want to give you the opportunity to speak a little bit more to this notion that that it's a number of different factors in the neighborhood that are really related to each other.
Yeah, so really all this is, and not to belabor the point, is just if you're interested in neighborhoods and where people live and how that can be used to promote nonviolence or to start thinking about violence prevention, you can think about any number of things that have to do with the neighborhood and think about working on those. So you could think about, well, how cohesive are people and how well are they able to work together to get things done, in terms of collective efficacy. You could think about neighborhood disorder, meaning, so Deborah Holden has done this great research that demonstrates that in neighborhoods where you see on the ground like empty alcohol bottles or drug vials, or you see like casings from police bullets, that those are neighborhoods that are called higher in neighborhood disorder, and they tend to have, even holding constant income and all other factors, neighborhoods where there's more disorder tend to have more health problems and more health challenges. So you can think about, well, is there a way that we could influence the disorder, so-called disorder in this neighborhood, and could that be helpful? Are there ways that we could try to improve trust between people or increase social networks or facilitate people supporting one another socially? And all of that is because of what you see in the other column, which is basically when families or people are living in isolation, then that leads to more stress for all kinds of reasons. You can't, run across the street and borrow a cup of sugar, or there's not a neighbor who can watch your kid for an hour while you have to run and take care of something really important, or there's not someone that you can go to when you feel like you're experiencing intimate partner violence and you want to talk to somebody about it. So isolation is more stressful for people, and that's probably why working on any of these things that reduces isolation shows up as helpful for people's overall well-being.
Thank you. And I am always great to hear you respond to some of these complex questions, Emily, and help us to kind of grapple with and make meaning of it. I'm seeing some questions that really, folks are really wanting to think about the practice and what are the implications for the practice. And we're about to turn to our next guest, who's going to talk about work on the ground, particularly focused on social inclusion strategies. But before we do that, Emily, I just wanted to give you a minute to see if you had anything that you wanted to say about, particular strategies or things that organizations can do based on this understanding of the research of some of these neighborhood factors, including social cohesion, social inclusion, collective efficacy, et cetera.
I don't know about that, but I'm just reading the questions and taking them in and seeing the one about sexual violence and stuff. And so maybe one example I can share from when I was a graduate student and I was learning how to do this research or think about this is people gave me the example of imagine a community where there's a kid who skips school and someone who's not that child's parent, leans out the window and says, hey, aren't you supposed to be in school right now? Your mom would worry about you. And so that's a neighborhood that has higher collective efficacy, higher social cohesion, and can work, basically if there's a sense that people are working together collectively to care about the well-being of one another, they may be more likely to say to somebody, I don't know, I had a bad experience leaving my child with so-and-so, so you might give just a little heads up about that, or you can leave them at my house instead. So I can't think of exact ways that this translates to sexual violence necessarily, but people leaning out their windows, keeping an eye on the street, being willing to talk to one another when there's something that worries them, like, ooh, I saw somebody came home really, really late last night. Was everything okay? So I guess those are some of the kinds of images that you can keep in your head, and imagine that if neighborhoods and communities are working well together and communicating highly, it creates a safer environment overall for everyone where it can.
Yeah. I like the cup of sugar example or the child care example, but I think it's one of the things that I've really worked explicitly in my life, and not necessarily, again, at the neighborhood level, but in my social networks, is the capacity to talk about issues like sexual violence and, protecting children or being responsible adults and that sort of thing. So, this notion of having relationships where you can explicitly address these various issues and take action on them in your community does seem very relevant. Is there, just last call, Emily, for final thoughts or responses to questions that you might want to address?
Well, I just saw people talking about, whether we're placing responsibility on individuals versus institutions, and I think absolutely the idea is that if we can learn from this research that there are aspects of neighborhoods that either worsen health for people or improve health, we should put the onus on the institutions to cough up the money, basically, to improve those things. If we can say, look, there's a pretty direct correlation here, and if you have this circumstance in a neighborhood and people are doing worse, well, that's something that you, institutions, should fix. So it's not necessarily putting the onus on individuals, but we can find ways of using that information to put pressure on institutions, and maybe also do grassroots stuff or neighbor-to-neighbor stuff individually as well.
Yeah, and I think, final concluding slide, that really what I'm hearing is that social cohesion, social inclusion, these are very important, and it's in the context of addressing multiple neighborhood and community level factors, and doing that through addressing multiple levels of the social ecology, which includes changing policies, changing practices, as well as helping to build community relationships or that sort of working with individuals as well. So thank you so much, Emily. It's always so great to chat with you and hear your thoughts on these issues. So hopefully you'll stick around.
Yeah, sure. Happy to help.
Yeah, as we move forward, but I'm really super excited to introduce our next guest, who's going to talk about both her thinking about some of these concepts, but how she's also working in partnership with folks in her community to put some community change efforts into practice. So I want to introduce to you Sierra Olivia Thomas Williams. She's a prevention specialist at the Indiana Coalition Against Domestic Violence, whose work focuses on populations such as people who have developmental disabilities and youth. And after 17 years as a victim's advocate, who coordinated prevention efforts as well for local shelters in Oregon and Indiana, Sierra joined ICADV in 2015. She was honored in 2013 as the Indiana Preventionist of the Year for her work, and also the ARC of Indiana, which is a disability advocacy agency, awarded Sierra the 2013 Innovation Award for her collaborations with the Stone Belt ARC. So welcome, Sierra.
Thank you. I'm glad to be here.
And I love that both of our guests have been honored with awards. That's lovely. So often our work is so unacknowledged and celebrated. So really excited to hear about your work. So Sierra's going to talk about social inclusion as a sexual violence prevention strategy. So you're going to tell us about your theory of change and kind of your interpretation of these concepts. But before you do that, I think it would be helpful for folks to just start with an idea of what your work actually looks like. So could you just share kind of the mission of the project that you'll be talking about today?
Absolutely, Lisa. Thanks. The Bloomington Inclusion Collaboration is an interesting sexual violence prevention initiative that addresses the risk factor of isolation by increasing the protective factors of social support and inclusion. So our goal for this project is really to decrease barriers to inclusion for people with a variety of disabilities through initiatives that begin with and grow from collaboration with those very people with a variety of disabilities.
Okay, so it's focused on people with a variety of disabilities, and you're trying to build social support and inclusion and reduce isolation. So that's helpful to keep in mind, and I'm really looking forward to hearing more about what that looks like. But let's start with your rationale. How did you arrive at wanting to address social inclusion as a strategy to prevent sexual violence against people with disabilities?
Well, our theory of the problem really tells us that some people turn to abusive behavior because of structural and social disadvantage, and other people turn to abuse through an experience of privilege. So these choices to abuse are mediated by the presence of other forces, such as social norms and risk and protective factors like safe, stable, nurturing environments like cohesive neighborhoods. So we believe that when we are enhancing and increasing social inclusion, that both of those motivations to abuse are addressed. Social inclusion practices meet people's needs but also hold them accountable. So our theory of change at ICADV is that in order for relationships to be both equitable and nonviolent, the equitable behavior needs to be the desirable, obvious choice. Abuse is not an option someone feels the need to choose. That means people are checking in with each other. And abuse is not an easily available option for someone to choose. So people are being called out. So the Duluth model makes it really clear to us in the field that isolation is a risk factor for IPV, but isolation is also a risk factor for sexual violence, both perpetration and victimization. And that's very clear in the CDC's Connecting the Dots overview. And isolation contributes to both of those then, IPV and SV. And so with our project, we collaborate to end isolation for people with disabilities from the community in general. And social inclusion seeks to modify power disparities really by insisting that all people have the support and are part of and within the community, and then we pursue that goal. So it really is a power-based strategy.
So what I'm hearing you say is that, isolation is very harmful, but, and I think, I'm seeing some of this come up in the text chat as well. It's not just that we want to move from isolation to tight-knit, it's not that we want to go from isolation to tight-knit, oppressive relationships or tight-knit, harmful community norms or ways of relating, but there's something very specific about social inclusion as a strategy that can address some of those harmful dynamics and address power inequities. So tell me how you have addressed the issue of power inequities in relationships through a feminist analysis, and how you've included that or integrated that with your public health social inclusion approach to preventing sexual violence.
Absolutely. The public health approach to preventing domestic and sexual violence really complements and enhances feminist theory and practice. And so this slide that people can see really indicates a few points of similarity and departure between the two frameworks. So here's how I see how feminism and my practices of feminism intersect with and work with public health. So feminism exposed population level inequality and called it patriarchy in the pursuit of social justice. So feminism really does argue for population level change. The whole social structure needs to change to become equal for everybody. And the pursuit of health equity, on the other hand, demands that power differentials are addressed and conditions are changed, much like a feminist intersectional analysis would illustrate. So feminism gives us a social justice framework for critique and analysis, and the field of public health gives us a clear methodology. So public health approach asks us to determine the problem, identify the risk and protective factors, and assess those, and then disseminate the strategies widely. That's what that little graph is on the bottom, is that 4-step public health approach. So this is what we used to determine what the barriers were to social inclusion in Bloomington, Indiana.
That's really helpful and really great. And yeah, I love that you have been so explicit about drawing on these two different frameworks. And it's really not one or the other, but both together. So I'd be interested in hearing then kind of what is the implications for your work on the ground. How do these apply and how do they inform the strategies that you implement?
That's a really good question. Feminist theory developed an analysis of power differentials and inequities and inequalities and exposed privilege, and that's awesome language. And feminism and the women's movement has really influenced the ways in which the problems of sexual and intimate partner violence are understood in the field. We have this awesome analysis of power, and abuse is about taking power over another. And activism and grassroots movements are powerful vehicles for change to this day, and yet we have learned from the past that focusing on just one issue alone, such as gender equality to the exclusion of other things, really eclipses the dynamism that is human life and the very real underlying conditions that allow for abuse of power in the first place. And we can have group cohesion without systemic inclusion. Cohesion is necessary, but it's insufficient to change conditions in the culture, which is what our task is. So at ICADV, we make it a practice to call into question the ways in which we have always done things. And the public health approach really helps us to do that in a methodical way. It allows us to address multiple risk factors or root causes, which really opens the field to endless and kind of weird possibilities for collaboration across different social problems. So we've learned from feminism to be diligent about our work and vigilant about who it impacts and how our strategies will or will not get us to where we need to go, where relationships are both equitable and nonviolent. So to move forward in that at ICADV, before we use a prevention strategy, we ask ourselves 3 questions, which are informed both by feminism and social justice and the public health approach. So with our strategies, we want to be sure our prevention strategies are effective. Will they work? Is the strategy efficient? Does this have the potential to affect a broad range of people? And the third question really is about social justice. Is the strategy ethical? Are we placing the responsibility for change on the shoulders of those who have the power to enact change? And so if the strategy is unfair to the most vulnerable, then we are outside of the pursuit of social justice, and the strategy is just not equity-based, and we won't move forward on it.
So I love so much about what you're saying. I think your point that we can have group cohesion without systemic inclusion, and that cohesion is necessary but insufficient to change conditions and culture. I want to create a slide with a quote from you to use in future presentations, so that I think makes it really clear that cohesiveness is important, but it's really, how are we building cohesiveness to change the conditions and culture, and who are we building cohesiveness with? So those are some great thoughts and questions to ask for, how to apply some of this thinking into practice. And I'm seeing in the text chat that folks are really interested in citations, literature that supports some of your analysis. So I hope that you will be willing to share that.
Absolutely. I'd love to.
So Sierra has shared a lot of her thinking, and we're also really interested in touching base with folks who have, especially folks who are already implementing these kinds of strategies in their work, let's go ahead and reach out and hear what folks are thinking again.
Yeah, so folks can just write into the text chat how you might be addressing power imbalances that contribute to SDV as a part of your social cohesion and social inclusion strategies into the text chat. Like Lisa said, where we saw earlier on that a lot of you are already implementing social cohesion and inclusion strategies. So we'd like to know how you're addressing power imbalances. So we'll come back to the text chat later on and see what folks are saying.
Great. So while folks are sharing kind of how they have thought about these issues and how they're addressing them in practice, let's go deeper into learning more about your work, Sierra. So please, how does this look, what are you actually doing on the ground?
This is really exciting to be able to share this with you. The Bloomington Inclusion Collaborative really began with about 20 people who have a variety of physical, developmental, and intellectual disabilities from an advocacy and services center called Stone Belt here in Indiana. And it was integral to the project that all of the leadership were on board and part of this process as well. So we recruited working professionals from a variety of both local and state agencies whose works spans the human lifespan and those multiple key sectors of society that are listed there on the slide. And we were tasked with figuring out, it's almost kind of like a needs assessment. We were tasked with discovering together what these barriers to inclusion were for people with disabilities in Bloomington, Indiana. So the next slide lists, I believe, our assessment strategies. So what we did is we spent the first year gathering data together, and what made this different is the data is gathered from the perspective of the major stakeholders who were people with a variety of disabilities. So I list there quite a few of the assessment strategies that we use, and I would be happy to share those with people, but I want to focus more on the participatory social mapping that we did with collaboration with the working professionals and people with disabilities, because that's really what the bulk of the process was. So the maps, they tell stories. They're political. We knew we were mapping Bloomington from a different perspective, from the lens of people with disabilities, and we really needed a way to show the data we were collecting. So as a collective, we created a geographical information system, a GIS, that was designed to, it's designed to capture and store and visualize data. And so on the next slide, we can see the first and second iterations of that GIS were done literally on the wall in the classroom. And maps are pretty political. They kind of outline, our lives, the geography of our lives, really. And we found we needed to concretize this idea of going into the community and looking for barriers using a map. So the first and second iteration of this GIS really speaks volumes about our stakeholders' experience of Bloomington as a community. It's very limited to the places where the stakeholders spent the most of the time, which was at home or the advocacy center. So we later added places that our stakeholders wished to go, and those data informed our decision of where to actually go out into the community to map Bloomington's barriers. And now we have this great GIS system. It's on Google. If you just type in Bloomington Inclusion Collaborative map, Mr. Ely, he's a stakeholder on the project. He created this Google map for us to help us visualize the data. This helps us tell our story to the people in Bloomington who have decision-making power. These are city planners. These are governmental representatives. And so what Mike did there was plotted the barriers we found, and he included pictures from Photo Voice, and he's adding in the narrative from the Photo Voice to go into those the barriers that we show on the GIS. So this GIS is now being used widely in Bloomington to advocate for systems change. So this GIS method is essentially giving voice to people who have, in Bloomington, never been invited to the process of city planning, for example, for safety.
Wow. I just absolutely love that you are mapping this stuff, and the way that you were doing it, participatory, really led by the folks who are impacted by these issues, and making visible what I think probably is not very visible, or things that probably people who don't have those experiences really lack awareness around. So can you just draw a little bit more, like, how, what are we seeing on this GIS map? I mean, it looks pretty cool.
That's a good question.
Can you just break it down a little bit more?
What you're looking at, I'm going to start with the biohazard symbols there. If a person were to go to the live map and click on that, you will see where someone nearly was hit by a car because of traffic congestion, even though we had the right-of-way. And we talk about how sidewalks and curb cuts are not great for people who are traveling by wheel, for example, in wheelchairs. So the bus stops are the places where we had to wait for the bus to get to certain places. And if you click on those, you will see pictures of some of the barriers that we came across, like waiting in the mud, for example. Some of the other little points on the map are the businesses and the public spaces that we mapped. And so if you click on those, some of the barriers will pop up, and there should be pictures. And so this is a work in progress. Mr. Ely has a bit of difficulty manipulating his hands. However, his knowledge and use of technology is amazing, and his voice is really coming through in this. So this map allows people to really see the places we went and what we found there in terms of, were there barriers to inclusion or not? Could we get in the building, for example? The red exclamation point, we had to wait outside for 15 minutes because we couldn't get into the building. There was nothing to facilitate that for people who can't open the door.
Yeah.
So it shows people kind of what it's like to go around Bloomington if you're blind, or to go around Bloomington if you are in a wheelchair instead of just on two legs. So it's neat.
Yeah. So this is, again, just really fascinating, and there's comments on the text chat about, really appreciating this use of the GIS mapping, folks who are talking about ways that they are using mapping as well. It reminds me of some work that folks are doing. I think it's called hotspots mapping in schools.
Yes, exactly.
Places where people feel safe or don't feel safe.
Right.
I also think of projects like Green Dot, where folks are trying to map positive actions and efforts to change community conditions that are happening, and make that physically visible as well. But let's take a moment to reach out to folks participating and hear a little bit more about this whole notion of mapping and participatory mapping. We realize that the mic problem is that we only have one mic that's working really well, so Casey's having to manipulate polls and move to the one working mic at the same time.
Yeah, so sorry about that, everyone. So we're going to ask another polling question. So again, just head down to the lower left-hand corner of your screen, and we're wanting to know just if you've ever used participatory mapping in your STD prevention work. So again, A is if you've never really heard of it before, B is if you've started to think about it but haven't really implemented anything, C is you've done at least one participatory mapping activity, and D is you use it all the time. It's a commonly used practice. So just in your left-hand corner, you can mark what is your experience.
What does it look like?
So it looks like that you have large portion of folks who have never really heard of it before. But as more answers come in, we have some people who are definitely starting to think about it. A few that have done it at least once, and then it looks like we have one person who commonly uses it all the time. So
okay, well, great
array.
So we're meeting our objective of introducing people to tools and resources for this work. Happy to hear that folks are learning about this for the first time, or many folks are. And, it also sounds like folks may have used it for other issues, but not for sexual and domestic violence prevention. And there's a question, Sierra, around whether or not you have, in your assessment, assessed for other issues. I think if I can find it.
Yes, I saw that. I'm so glad that you mentioned that.
If you're asking about if families feel isolated or supported, I think.
Yes. So all of the stakeholders completed a social network map before any kind of collaboration or intervention or social mapping into the community occurred. And so this is a tool. I had a terrible time finding anything that would measure inclusion from the perspective of people with disabilities in the field of sexual violence prevention. So I expanded my search to other fields and found a very commonly used tool called the social network map, and this is out of social work field. It's by Tracy and Whitaker, and so what this does is it measures the 7 domains of people's lives, including family, and it asks people to talk about their support, their concrete support, the emotional support, the closeness that they have with people. So we did this before any intervention, and we did it in mid-project, which was a couple of months ago. And so we will do it again before the conclusion of the entire thing, just to kind of, it's the entire project, to see if any increase in people's social network happens.
Oh, that's great. So I really like, and I think this reinforces a point that we were making earlier, that there really is an interaction between social factors as well, like social support or social networks, and other factors in the community environment, like these built environment considerations that folks mapped in their community. So I know you're going to talk a little bit more about how your efforts are building social inclusion, but you also talked about kind of the structural and physical barriers. So maybe I know you have this great slide where you're sort of visually representing some of this. So can you talk a little bit about how you are addressing structural barriers to inclusion?
Absolutely. So the participatory mapping process really allowed us to go into the community and identify structures that differentially impact people with disabilities in order to be able to advocate for changes in our neighborhoods and our businesses and public spaces. And so what you see here represents some of the barriers that we found. We have pages upon pages of barriers and hundreds of pictures, and so these are just a few. I want to point out that the illustrations are done by Jay. She's our project artist and illustrator, and this is what it was like for people to wait for the bus in the rain. The people in chairs got really, really wet. The people who were standing were still muddy, but not as wet, and we couldn't get into the mall, which was kind of a bummer for a while. So these images represent just some of the barriers we found. And so in the last 15 months, we've brought emergent leaders with disabilities together with established leaders locally and at the state level. So these particular people have not had the opportunity to learn and lead together before. So this process really is building competency and understanding among working professionals in the community about issues of disability and kind of helping them to assuage any anxiety that there is around engaging with and supporting people with disabilities. And this fosters community belongingness and civic engagement through inclusion for people who are not usually invited to the table. They might have cohesion inside Stone Belt. They certainly have cohesion. I haven't measured it, just so you know. But once they walk outside the door, the cohesion kind of crumbles when they enter into the larger community.
So by bringing together emergent leaders and established leaders, you're really building more cohesiveness and inclusion in a way that really does address power inequities. And you're bringing to light also ways that exclusion is built into the physical environment by how people experienced transportation and the ability to access community resources like shopping. So you've really done a lot to map out some of these problems, and I'm curious, you've done such tremendous assessment work, and and you're addressing social inclusion in the process of this assessment work. So what is the work going to look like moving forward? I mean, where are you going to take it from here? What does the work look like from here?
I am really excited. We are honored, me and two of the community stakeholders who have been with me from day one are going to be able to present at the National Sexual Assault Conference in DC. So I really want to invite people who are going to come to our session and get tools. This is just a smidge of some of the project activities that we've been doing together. So with behavior change, you have to actively engage in it all the time, and that's why it's called active intervention. So in that area, we are doing leadership and healthy relationship building for people who tend to not get access, say, to sexual education and healthy sex practices and healthy relationship skills. Something that's been really productive is the cross-agency trainings to build familiarity and competence to serve people across a myriad differences. With the structural or environmental interventions, those are called passive because they outlive the funding. You don't have to attend to it every single day. For those, we are doing library renovations to make it safer for blind patrons. We are looking at and revising some organizational policies, and some of the exciting work that we're doing now is broader systems advocacy, specifically around roadway and sidewalk connectivity, which just blew my mind. I actually have never thought about that. So if you go to the next slide, I think, yes. So roadway and sidewalk connectivity, or the lack thereof, was really prevalent as a barrier across all of our excursions that we did into Bloomington for people with disabilities on this collaboration. Sidewalk connectivity might not immediately seem like a strategy to end sexual violence, but sidewalks are passive. We don't generally think about them. So there are passive means to traverse where you live, work, and play. And they also facilitate connectivity, financial, medical, and social connectivity, which are so important to all people, but especially to vulnerable people. So we're talking about connecting to one's most basic needs. And the broader the network, and Emily was talking about this earlier, the broader the network, the more support is available to allow for more inclusive spaces, places, and people. So ultimately, connectivity among people is a protective factor against violence because connectivity broadens social networks so that there are more people checking in and more people calling out. And this checking in with people about their day and how's it going and calling out on bad behavior or inappropriate meanness addresses the social norm of privacy and the social norm of silence that allows sexual violence to continue.
Wow. Really interesting work there, and I want to just go back to the previous slide where you talk about your different work. If I can ask you a little, well, first of all, I really appreciate the distinction between the active and the passive, and that by changing the environment, we can make the desired behavior the easy and expected behavior. So I think that really is makes the case for trying to create, policy change and systems change and changes to the physical built environment in communities. Can you talk a little bit about, what that systems advocacy looks like?
The systems advocacy that we're doing?
Yeah.
Sure. We've ran across the barrier of being able to have people with disabilities go to the open mic events. They're not called. The term I'm blanking on, but when the city officials get together and they want to know what's going on in Bloomington and how they can help, and when they talk about all of the things that we're working on, there's space to go and talk about how these initiatives are affecting them. And so what we've done is we've put together a variety of ways, including that GIS map, to bring the voices of the people who can't be in the room because of barriers to alive for the people who can make decisions. I took the photo voice and a couple of videos and the GIS map to a city planning meeting about a couple weeks ago, and got a lot of really great connections, and people were jazzed about the specific area with sidewalk connectivity that we were eager to work on. And I have to say, since we started talking about it, one particular area has 2 more blocks of sidewalk, and they also have a flat concrete place where people can wait for the bus, where a lot of people with disabilities wait for the bus. And there are probably other things that go into the city developing these things, but I think when you bring the voices of people who have in many ways not contributed to letting people know what the problems are, it tends to be very powerful. And it seems to be, yes, town hall meetings. Thank you, Jennifer. It seems to be a very powerful and persuasive argument when you're forced to think about what it's like to be a blind person and the sidewalk just randomly ends. I bet there are people out in the audience who have experienced that themselves, and what would you do? Yeah. How do you know if walking on the shoulder is safe? You don't. Do you know if it picks up on the other side? You don't, if you're blind. So these are very persuasive arguments to the people with power to influence change in our city. And that ultimately expands people's networks. One of the things that sidewalks help are for people to be spontaneous. People who receive disability services are really don't have the opportunity to be spontaneous very often. And safe sidewalks and bus stops help foster spontaneity, and it's so important to be able to engage with life and live it, not just, survive.
So, you've taken us through the thinking and the theory behind your work, the methodologies that you've used to combine your different values and frameworks into assessment and planning, and how you're now advocating for changes and really changing those structural conditions in a way that does so in a way that builds greater social inclusion in the process of doing that. And so it's really exciting to see a specific project that just brings all of this together for a very specific community, your community in Indiana. And but I know, Sierra, you are a very thoughtful person. In addition to doing local work, you're part of this Prevent Connect national learning community, and you have thoughts and insights about kind of the broader implications for some of your thinking and your work for the field of primary prevention of sexual and domestic violence. So just wanted to give you an opportunity to share any broader points that you would like to make that you think this community can learn from you and the folks that you work with around social inclusion, patriarchy, power inequities, and strategies to prevent sexual and domestic violence.
Absolutely. I'm really encouraged by the shift in prevention, kind of going back toward the collective we, where we are, as a community and as a movement, deliberately looking at intersectionality as a lens and a practice. And the Full Frame Initiative, for example, is interested in addressing survivor needs through systems change. So they're really interested in meeting the needs of the most vulnerable, they say, down to the last girl. And this framework really positions us to better address special or underserved populations. So if we think for a minute about the analogy of the table that just came up in conversation over lunch, actually, and the discussion over the last few years in primary prevention about, say, for example, bringing more men to the table, or in committee meetings when, everybody on the phone right now is probably in 100 committees, and we ask ourselves, who else needs to be at the table? Well, social inclusion means we dismantle the table. We need to take it apart entirely, and we need to go to the people who we seek to bring into this work, and we need to be humble and ask them if we can help, and ask them to show us the shape of that help. How can we help? It's very exciting, these pivots in the movement to end violence, and it's really asking us to challenge ourselves and change the way we've been doing things and take a hard look at what we've been doing to see if the strategies really work. And I think that with some of the stuff we've been talking today, we can really get there. Some of the problems with, I've seen a lot of questions in the chat box about evidence-based strategies, and they're so, so, so important. But think about the underserved communities. Some of the most amazing work in sexual violence prevention is being done by and in communities who have no access to academia. So their projects can't hope to reach the level of inquiry that the evidence-based demands. And of course that's experimental design. All of that is so, so important. And so the evidence-based strategies that we see emerging are curricula, and those are great, but they're limited in scope because they seek to change behavior, and the problem with power disparities is much larger than behavior. We are tasked with changing a culture that allows for violence. So we need to address underlying conditions and roots for violence, and I'm encouraged that that's the way we're going.
So, of course, you talked about research and academia and evidence-based, so I need to see if Emily is available to chime in here.
That'd be great.
I'm here.
Emily, you've been listening to Sierra talk about her work and what it looks like on the ground. I just wanted to see if you had any reactions to what you've heard, and also kind of the implications that she's drawing out for the broader field and the building of our evidence base.
No, well, first off, just to say it's incredible. This is great work. So thank you for the work and for explaining it to all of us. And yeah, I guess, I think I saw in one of the comments, or the main thing that this brings me back to is the idea that if we start believing in this idea that, okay, we want to address neighborhood factors or strengthen communities, increase social cohesion as a route towards reducing sexual or partner violence or any other form of violence, that you have to sort of, I think, let the clear connection between those two things drop just a little bit for a moment. I mean, you hold on to it in the back of your mind, but I had a colleague in Rhode Island working at the Newport, Rhode Island domestic violence shelter, and they decided, we believe in this collective efficacy stuff and we want to use it to reduce partner violence, and we think it can. So they came up with a bunch of different projects, including having people come out and help paint a mural together and do some other projects. And painting that mural, it wasn't like going out there that day you would see the clear and direct connection, the obvious connection between people getting together to make this mural and how it was going to directly impact domestic violence like the next day. So you almost have to suspend your disbelief or whatever, or have faith in this idea that it will have an impact and we'll get there. And also be willing to almost surrender a little bit to this idea that strengthening communities creates overall better health and well-being, and sexual and domestic violence prevention is going to be part of that, but it probably also means reductions in suicide and self-harm, or substance use and misuse, or we're creating healthier communities. And so our pet topics may become one of many things that are being addressed, and I don't think it dilutes the impact that it necessarily has on any one given topic. It just means that we're in a way sharing the space of whatever our goal is when we shift to working on neighborhood strengthening overall. So I don't know, hopefully that makes sense, and also shouldn't maybe hopefully dampen anybody's interest on working on social cohesion or collective efficacy. Sometimes it's just like a little less obvious or a little less clear how it exactly translates into like a one-to-one improvement from the effort that you put in.
Yeah, I think you make a really good point that this is the long term. These efforts are about longevity. These outcomes are distal. They're down the road, but I believe what you said to be absolutely true. We'll all end up with overall health and well-being.
Yeah. And I like that you talked about connecting the dots to other issues, Emily, and of course that's one of our upcoming web conferences. I think not the next one, but the one after that. So thanks for invoking that. And, I think that it can feel sort of broad and distal, but I think that so many important points have been raised in this web conference about the very specific ways that social cohesion and social inclusion are very directly related to sexual and domestic violence. And there was a text chat question that says, is the idea that if a community has strong social cohesion, then members of that community are more apt to promote social inclusion and perhaps vice versa? I would kind of even ask, is the idea that if a community has social cohesion, are they more apt to be socially inclusive and equitable and less violent or oppressive? And I really heard today that the answer to that is no, and that what we need to be doing is addressing the specific power dynamics in our relationships, in our social structures, addressing how that is created by policy and resources that get directed or not directed into communities. And so it's really about building social cohesion with this equity and social justice lens, and that we are building communities that are cohesive around equity and inclusion and nonviolence. So that's kind of what I've heard today, but I'm really curious to hear from both of you your response to that question.
Yeah, I think you really got it, Lisa. So I couldn't have said it better myself. I think it sounds
ditto.
Right on. Yeah.
I wanted to say hallelujah.
Yeah.
And also stand up and wave my hands.
Well, I hope you did that.
I did.
I'm about to myself. So we have a few minutes to talk about a couple more questions that have come up that I think are really important, and then perhaps end with some resources. So earlier on, someone said, what is the relationship between patriarchy and sexual and domestic violence, and that patriarchy shows up differently in different cultures. And someone mentioned that they're working on an Asian violence study and interested in patriarchy and power and the relationship between that and sexual and domestic violence. So I'm wanting to pose this to both of you, but Sierra, you did work that was sort of very community specific.
Right.
Just wondering if you have thoughts about how this kind of work that you've done can address cultural issues, that might be specific to different communities with different histories and cultural?
Ooh, that's a big question. I think something that I think about a lot when working with this particular community is that male privilege and white privilege doesn't attach in the same way to people who identify as men or people who might have lighter skin in the community that I'm working with who have a variety of disabilities. And so some of the ways in which we understand privilege to work doesn't work there. I mean, privilege definitely built the structures that outline the everyday for the people with disabilities that I work with, but something that I've been struggling with and to understand is even just contemplating that question, what is the relationship then to patriarchy and sexual and domestic violence prevention for this specific population? But the thing with inclusion is that you start with what the community needs. This project has opportunity for scale because what is asking us to do is bring underserved populations to the center and collect, kind of figure out what they need and move forward from there, or not even what they need, but what would you like to do? What would you like to see change, and starting from that. And I use my privilege, being able to drive, being able to go at night to these meetings with government officials to pass along the information. So I'm being very cognizant that I have privileges that my stakeholders don't have, and I'm hoping that I'm using those in a way that is not taking an advantage, but rather being helpful. And I know that doesn't speak directly to patriarchy, but Emily, do you have anything to say around that?
No.
Okay. I feel like it doesn't attach in the same way to the people that I'm working with, and so the liberal feminist analysis doesn't work, and that's why looking at Black feminist theory and intersectionality is really helpful in understanding how different, like your class and your race and your background, and including things like what Emily said, where you live, all of those things matter, and we need to start with those and suss those out and move forward.
There's a comment from Amanda Pickett that she's beginning to see these issues from a global social cohesion and inclusion perspective. And so kind of what I'm seeing is that, yes, we need to look at how these things play out in relationships, in neighborhoods and communities, and that what happens in neighborhoods and communities is shaped by these larger structural global factors, right? And so immigration, racism, xenophobia, all of these things are part of those larger systems that patriarchy shapes the social cultural environment in neighborhoods, in communities, who gets included, who doesn't get included. And I think what you're offering, Sierra, is that which touches on another question that I was hoping we would get to. Oh gosh, we're out of time.
Oh no.
Don't go.
So that really important point is to work with the community, to partner with the community, and that the community can identify what changes that are needed to help make those environments safer for them and reduce sexual and domestic violence. So on that note, thank you both. Thank you everyone for a very rich conversation. I hope that it was useful to folks, and we will follow up with additional resources, including literature, and please share your examples of work that you are doing as well in the Prevent Connect community. Thanks everyone. Have a great rest of your day.
Thanks. Bye.